All right, good morning and thank you for keeping it Citizen Television. We really appreciate your time and company. It is Wednesday. Health and Lifestyle is the show, the segment that we are having right now on Daybreak. We really appreciate that you could join us today as we talk about mental health in families. And today we will have a very special bias on men because there's just a lot that has been said and done when it comes to mental health and how it's affecting women and children. I'm not saying it's enough, but there is still a big silence, a very loud silence when it comes to matters mental health and how men have been able to deal with these issues, and even spaces that have been created, safe spaces that have been created. How friendly are they to the men and how acceptable have they been to the men? And we have a lot of scenarios that we have seen the outcome of the lack of just addressing this issue among the men that has been very disheartening. We've seen men getting into alcoholism, getting into drug addiction, getting into drugs. Unfortunate stories of men just turning against their families and killing children, beating their wives. And I can go on and on about how men have been pushed to the wall to just sort of like find a way of dealing with whatever it is that they are going through. The most unfortunate thing is that a majority of them don't even know that they have a problem. And that is what we want to talk about. And I'm having a panel of two, a lady and a gentleman. So at least we'll have a cocktail of experiences from both genders, and they're experts in this field. I'll begin with, from my far right, we have Sabine Biemba. Sabine is a counseling psychologist, young and passionate about mental health, working with Let's Talk 254. Let's Talk 254. And of course, we have Anthony Muoki, clinical psychologist. Anthony is also an author of a very interesting book, The Fortitude of the Resilient, that he was telling me actually carries a lot in terms of the wealth of knowledge of helping you just have the life skills that you need. And in the event you reach a breaking point, how do you bounce back, mentally? Karibu sana, lady and gentleman, to the program. When you heard we're going to talk about men and mental health, let me begin with the man. Let me be fair. What came to your mind? What really stood out for you about this conversation? If you look at what is happening in the society right now, Anthony, what is it that came into your mind and you were like, I think it's about time we talk about men and mental health? Actually,
feeling like it's actually the right time to talk about it was the first thought that crossed my mind. It's something that I'm totally very passionate about. Mental health is complex, and despite the fact that major diagnosis assessment have shown that both men and women get affected the same, it has also been evident in matters data that in most cases men don't seek help. In most cases, comparative to our counterparts. And so I felt this would be a platform to sensitize them and to encourage them through this conversation, see how best we can encourage each other as men to seek help when it comes to mental health concerns.
Yeah, seeking help is one thing, and knowing you have a problem is also another conversation that we should be having. Because, like I said, a majority of men out there with this problem, and they don't even know it's a problem to begin with. I mean, wanajikaza kukua wanaume, you're supposed to be a man.
True.
And who even defined what being a man is, that has really set the bar too high for a majority of men who are walking broken, feeling like they need help, but they can't really reach out because society has not prepared them to be in a space where they're supposed to even ask for help. I'd also like to hear your thoughts on that as well, Sabine. When you heard we were going to talk finally about men and mental health, what came into your mind? What are your biggest concerns when it comes to how this subject has been handled among the male gender? And I know in your work, frequently you interact with clients and people who need help. If you look at the patterns, men compared to women, are you seeing what he is describing, the shortage of men who are reaching out to people like you for help, for instance?
Yeah, so let me start by saying that this topic came at the right time because there is that need of men going out and speak. We as African, I think we have been in a community whereby mtoto mdogo, wakiwa wadogo, they have been told that as a man ni mwanaume kujikaza. As a man you're not supposed to speak. So this mentality imewekwa tokea wakiwa wadogo, and unfortunately men have grown with that. You see now, nikiwa mdogo, mwanaume ni kunyamaza, mwanaume ni kujiwekea, mwanaume ni kujikaza, and that is so unfortunate because they're human beings like us. You need to speak. So for me, I feel like the topic came at the right time, and now it's the right time for us to break that stigma and encouragement to speak. There is that need for men to speak. I'm a sister, I have brothers, and I don't think if there is that difference between me and my brothers because we are the same. So I have feelings, they have feelings, we both have feelings. So it's our duty as a community or as a nation to break the stigma around this and encouragement to speak about mental health. Yeah.
Anthony, earlier you said men don't come out to seek help. From your experience, is it because they don't have a problem, or is it because of what exactly? We want to identify the problem from the very root cause before we can even begin talking about how the way forward on this.
Interestingly, when we're talking about mental health, we don't basically talk about absence of mental illnesses. Rather, we are emphasizing on someone's stability and ability to maneuver through these social, psychological, and economic dynamics without, manifestations of dysfunctionalities. And in regard, a number of factors actually make it difficult for men to seek help. True, number is seeking for help, but not as comparatively to women. And the first one is our society, as you know, our socialization as men. It is expected as a man, because of masculinity aspect of how Africans especially has perceived men, seeking help, asking for help is as a sign of weakling. And that's why I feel we need to have this conversation so often. So that we embrace the fact that when you're talking about psychological concerns, our human brain is so dynamic that it does not care whether you're a man or a woman. And so when we are faced by, challenges in how we think and how we feel and how we are behaving socially, I think it's high time we start acknowledging that before we became men, we were human beings first. So the expectations of the society and what society defines as normal, as decent, and the societal pressure that man has to be strong is one of the things that make it difficult for men to actually do it, to seek help. And you rightfully mentioned initially that before we start talking about asking for help, we need to first acknowledge that we have a problem. But I would wish to challenge us that how many of us actually know mental disorders, apart from depression and stress? So we need to create this awareness so that we become very aware of, how diverse mental illnesses are and how seriously they are affecting us. Because the other obvious disorder that people are focusing on is substance dependency, which sometimes can exist as a comorbidity where more than one psychological disorder is to play. So we need to actually create a lot of awareness matters about the nature of mental disorders and how they manifest and how they affect us. And I think already this forms a foundation for us to have such a conversation.
All right, and we'll talk about that shortly because you are a counseling psychologist and you're a clinical psychologist. I know in your line of work you deal with these challenges but in a different perspective. So let me begin with you, Sabine. In the context of men and family, if you look at the mental health disorders that he has talked about, which one touch mostly on your area? I'm sure it's very common. You've heard even people say that men are not emotional beings. Men are not, supposed to be those people who vent and talk. Talk to us about some of the emotional challenges and emotional, issues that men can go through that can actually break them down mentally, things that may not necessarily be clinical, so that he will come in and tell us about the clinical disorders that men also go through.
Okay. I think I would like to say that men do have emotions.
They do.
Yes, they do have emotions.
Yeah.
They do have feelings. Men cries, men speak.
They feel sad.
Yes, they feel sad. That is very true. So men are just like us. They do have emotions. So one thing I came to realize, a man can go through a breakup just like us. Yeah, nimependa dem nimemkatia amenikataa. At the end of the day kuna hiyo feeling. Yes, I will feel bad because nimekataliwa. Kuna mtu nimenock mahali amenikataa. Yes, nitafeel vibaya because I have also, they do have feelings. So we need to normalize that. They do have feelings just like us. Men wanapitia, they go to work. Wakienda huko kazi, you see now, because now as in our African community, men are the providers. They are supposed to provide for the family. What if, because of the economy we have in our country, it's not, economy yetu haiko sawa, I can say that, haiko sawa. So nakuta men wamebeba hiyo, like as a man I need to provide for my family. But now, nimeenda job, nimekosa so, sina so, maybe I need at least so watoto wakule, and then the moment narudi home, nikiangalia watoto, there is nothing. You're not taking anything home. Yes.
And you have an angry wife, a hungry
yes,
family
it's not
waiting.
easy for them. Unakuta because of that situation, a man lazima tu, kuna venye atafeel, and unfortunately men hawaongei, they don't talk, they don't speak, because now who am I to talk? I mean, nitaongea na nani? Who am I supposed to talk to? Nitaenda wapi? If it's counseling, I need help. Yes, I'm willing to do that. But now because of the cost, because of the distance, because of the economy we are in, it's so hard for men to get that help. But now I would like to encourage men to seek that help, because they have feelings, they wanapitia the same emotional whatever that we women goes through. So kama naweza kuumizwa, even a man
can go through the same.
Yes, can go through the same process as me. Kama naweza feel like I need to eat na siwezi to provide for my family, imagine what about a man? Because now the community, our society is looking at a man as a provider. So if a man does not provide, can you imagine what that man is going through? Ama huyo mwanaume anafikiria nini? Like anafeel aje? So we need to understand that even them wanapitia the same as us. They are not different. Hawajaumbwa different with us. Because now I want to say, like, actually in the Bible, sisi, we are the rib of the men. Tumetoka.
Wow.
Wow means, like, I don't know, you can feel me. The same feeling they have, the same feelings.
They're not really different. They're not,
they're not numb. They're not like mbao, you bigger, like they don't feel, they do have emotions.
Feel the pain.
Yes, they do go through.
It's good that you've sunk us deep into the world of men in that perspective. A perspective that many would term as weak, as Anthony was saying earlier, that if you define a man in the context within which you have defined, then that's a weak man. That's a man who does not have their thing going, like hajajipanga, si mwanaume enough. And it's good that as an expert you have said it's actually normal. It's okay for a man to find themselves in that space, to feel pain, to feel broken, to feel disappointed, to feel inadequate. It's actually fine. What we are talking about today is, what do you do now that you have found yourself in that particular space? And I'd like you to weigh in on the same. She has talked mostly about the emotional aspect of how it relates with the mental challenges that men go through. But I know there are so many clinical, ways of defining mental health that people have not even explored. All we know, like you said, is just niko na stress. But do we even know what this stress is? There is something you said very interesting about dependency on substances. This is very common among men. Smoking, drinking, and gambling, and just finding anything that can actually keep you going. Talk to us about how it presents in the different formats, so that people can begin understanding the problem before even knowing how we get help for it.
I would wish by appreciating statistics first, that here in Kenya, it has been estimated that 1 in every 4 members of the public, the general population, as a mental disorder. Mental disorders that maybe I would mention the common one.
1 in every 4.
Yeah.
1 in every 4, like
That's very close.
Yeah.
3 here. What do you mean?
If we end up 4th individual, someone
That's
here,
very,
statistically
very
speaking,
close. Yeah.
and that shows how serious these concerns are. But the major disorders that we've seen through experience and data as presented, we're talking about depression. Major depressive disorder is one of the common mental disorder that is cutting across. Talking about anxiety disorders, you know, it's a series of disorders. We're talking about bipolar mood disorder. Bipolar has become, recently we've seen lots of individuals manifesting with bipolar mood disorder. Bipolar and depression actually are mood disorders, but they are distinct in their own different ways. And we've seen stress-related conditions, again, diverse.
The most abused word.
The most abused word.
Nikona stress. Anything Nikona stress.
Nikona stress. You know? But it's worthy acknowledging that most of mental disorders actually have that distress aspect as a symptom manifesting in an interesting way. And then you just rightfully mentioned about substance use disorders. And I like us reflecting first at how sometimes we find ourselves talking about it. We realize that individuals sometimes they find themselves in substance dependency as a maladaptive coping mechanism. You know, so many people acknowledge that I started the day I was broken. I started the day I lost my job. I lost, I found myself in this situation the day I lost a significant other. So they manifest in diverse ways: irritability, sadness, helplessness, and hopelessness, which actually is one core parameter that we look when we're talking about depression. It's a major cause of suicide and homicidalities, you know. So these manifestations, ideally what they do, they create a dysfunctionality, you know, that manifests in an inability to cope with day-to-day, activities and day-to-day life. And that makes it very complex and very difficult for individuals to cope. So
do they have like common signs and symptoms that can begin, like telltale signs for somebody who's watching, for them to know, hey, niko na shida, I think I need help?
Very true.
What do they watch out for? Very
true. But I would like to state clearly that every mental disorder has its own criteria for diagnosis. So there is a package of symptoms that you would assess and analyze through assessment, scientific assessment, so that we don't label individuals.
All right.
Because you may find some disorders have symptoms that kind of relate, but description, the distinction might be in terms of time frames. For how long have you been sad? You know, have you been sad for long hours of the day, for many days of the week, for more than 2 weeks? You know, because sadness can manifest during when someone is stressed and when someone is actually depressed. So irritability, you know, any abnormality that is touching in 5 human dimensions that is making someone struggle to adapt to day-to-day activities, including even finding it difficult to, to leave your bed and wake up and prepare for job.
You just want to sleep.
You just want to be.
Yeah.
And we've had patients say, I would wish to sleep and never to wake up. That sometimes might be a polite way of someone showing signs of I wish to die. They have lost purpose. They feel they have lost purpose. They have lost hope, and they feel helpless. You know, so different disorders have different manifestation of symptoms. But for us to clearly define and identify what disorder someone has, assessment and screening is very important. And not only to pick a disorder, but also to look at the severity in how it has manifested, because the level of severity dictates the approach of treatment and management.
That will do.
Yes.
I'll just take you back on the dependency on substances, because that's also something that men are really struggling with.
Yes, please.
What would be your sentiments around that, how it starts? Because today you'd find even men, your fellow men would call you, come we talk about it. Kuja tuongee kama wanaume. And the first thing they will tell you, take this one. You know, shika hii chupa, you know.
Yes.
I mean,
Very true.
Yeah? So you talk as you're already engaging in something.
Yeah? Allow me very fast just mention how we find ourselves having addiction, which is a brain disease. It starts with use, substance use, you know. Substance use is inconsistent, infrequent, small amounts, random, right? And then from there we go to abuse. Abuse is where we substance use abuse. Abuse where we are having sequence, pattern, and some frequent.
Which you can follow.
Yes, and the reason why we are calling it abuse is because you are almost started seeing some, you know, challenges that are associated with you using the substance, but you still not stopping. Yeah. You know, like for example, you've just entered a minor accident that is associated with your poor judgment because you are intoxicated. But even despite that, like we've had conversations about Jana Kuli and Ajay, you know, they reflect that they can see some red flags, but they still don't stop. So that's at what level you talk about abuse. Then from there, it graduates to tolerance. This is where the body and the central nervous has adapted and it has realized that there is something this gentleman or these ladies doing to me, you know, and I'm liking it, so it adapts. And how it manifests is that for you to get the same euphoria, that feeling of I, you need to use relatively higher amounts of substance for you to get the same impact. So if initially 2 bottles were enough, you need 4, 5, 6. And this is where, this stage is very important in our conversation, because this is where we also, different patients, individuals start pulling other substances on board. Because already the initial one is not giving them the high. So they introduce other substances, you know, and that makes it even more complex. But remember, it's still carrying the aspect of pattern, of sequence, of frequency, and the amount is increasing as we progress.
The variety.
Yes, and the variety now. And then now we progress to dependency. This is where
you can't now live.
You can do without, but for you to actually do it more appropriately, utatoa lock, quote and quote. You know, to me, kutoa lock is not basically addiction, but it's an advanced level of tolerance. And now the system has adapted and has started to embrace the fact that there is something you're doing to me, and I like it that way. So you'll need to do it again, so that and so the major outstanding aspect is that we start getting maybe cravings for the same. Start now getting cravings. So from that level, now we go to addiction, which is like the topmost epitome, you know, which is a brain disease with these clear manifestations. We're talking about excessive cravings, and because we've realized there is a problem, when you stop, you start getting things we call withdrawal symptoms, headaches, shivers, tremors, you know, and so on and so forth. So stopping becomes a problem, continuing becomes a problem. And, you know, at that level, again, you lose the willpower in most cases. And that's why you find individuals are willing to step out of their way to fix their life, but they are struggling. And in most cases, that's the level that we've seen people going for rehabilitation.
And funny thing, you never really know how you graduate from one level to the other. How he has run us through use to addiction. Use, you just go in, then you get to abuse, then you get to dependency, then you get to addiction. And you never know like how you graduate from one level to the other.
Maybe to mention, it's not always for every individual to follow the sequence.
You can jump from use to addiction.
And before you know it, you're on the other side.
You're addicted.
Yes, and that already, you know, it makes it more complex.
Sabine, do you have any other coping mechanisms you have seen? It could not even necessarily be just men, but patients who are dealing with mental health may not necessarily be addiction to a substance. But what in life have you seen people, you know, going for some disastrous or destructive coping mechanisms that probably concern you as a psychologist? Just to go by, to keep going.
On my side of none, I can say that.
All right. So let's talk about, once you have identified that you have a problem, and both of you have tried to demystify the problem for us. What should be the next step? How do you begin? And I know you're doing something around making therapy more easy, acceptable, and relatable. But where does the journey begin? How do you start?
Okay.
in a society that has really high standards for men. Mwanaume hafai kwenda kujiongea huko nje, as in how?
You see now, we spoke about the stigma around mental health. Before technology came in, now we live in a world whereby technology is at our finger tips.
Yeah.
You need help, you go to your phone, you get access to whatever you need. So before technology came, ulikuta, you find someone, if I need help, because I feel depressed, I feel I have this feeling, and then I tell someone, and someone tell me, maybe, why don't you consider therapy? So you find someone, the process of looking for a therapy, let's say I live in Thika Road. For me to get a therapist, I will need to go where? To Kenyatta Hospital. There is that distance. The moment nilipe from all the way from Thika Road to Kenyatta, that is cost. So we are looking first, I want you to know there is cost there, and then there is time. For me to get all the way from Thika Road to Kenyatta Hospital, that is 1 hour, ama 45 minutes. You get it? Nifike tao, nione vitu vizuri, I might change my mind, because now if I'm going for therapy, I need help, but now what if people judge me? Nikifika hapo, and then I tell them I feel depressed, what would they say? Mimi siniingie zangu hapa nikunywe, I get something for myself. So kuna hiyo, you can change your mind, you can do whatever, but because of that kuna time, kuna stigma around, kuna changing your perspective about going for help. But now we have a solution for that, and that is technology came in.
And there's a cost implication as well, and the sessions that you need.
Yes. You
to go for therapy.
You pay maybe 1,500 for therapy. 1,500. The distance for me, hiyo nimelipa mat imeisha, so alafu nilipie session 1,500. That is 1,600 nirudi 2K. You see now, in this economy, I cannot, it's so hard for people to afford that amount of money. But now I was saying technology came in. So we have a product. There is a lot of products which you can just download it on your phone. You get it? Let's say, for example, Let's Talk 247. This is an online platform that connects professional counselors, not AI, but these are real counselors registered by the Board of Kenya, and they are ready to save you. And this platform, like I can say internet, you only need maybe 50
before we even get to the interventions, maybe I'm keen just to hear more about the barriers, because I like how you've broken it down to even the cost implication. That's now being addressed by the technological aspect that you're introducing. But Anthony, you still operate a physical sessions, right?
Yes, true.
Maybe also from your end, what are some of the barriers to access therapy that would hinder somebody, not necessarily just men, just somebody who needs help from getting it, in the physical space?
I hear you. Allow me start by mentioning that it has been observed that 75% of general public struggle to access mental health care.
75%. This is 75% of those who need it.
Yes.
And they can't.
Yeah, they really struggle to get that. And some of the challenges, as now rightfully you've asked, is what really makes it difficult for people to actually access it. One, the service providers, is a challenge. Up to this moment, I acknowledge that there might be several county governments who have not engaged, professional counselors and psychologists to support in different capacities. We need also to acknowledge the fact that these services are relatively expensive, as you've mentioned. The charges actually range from maybe 15, as she has mentioned, to 6. Averagely is around actually 3 up to 5,000 per session. And a session actually a session is around 45 to 1 hour, 45 minutes to 1 hour. And most of these disorders and conditions we're talking about can go up to more than 10 sessions.
Yes.
you know, and depending again the conditions we are managing and the approach we are using, this frequency, because it can be even be weekly or fortnightly or monthly or after 3 months, you realize that cost implication is not very easy. And now another major challenge is that there are a number of insurance institutions that are not, policies that are not covering mental health concerns. And I think it's high time this conversation now goes to that, towards that direction. So accessing becomes a problem. And again, you also realize setting up for these services, for these offices and these avenues, it is a challenge, because sometimes you may set the facility, but the members of the public, as you have mentioned, may not be well sensitized, you know, for walk-in sessions. And that's why now there are interventions, there are a number of websites. It is very interesting that it has been mentioned elsewhere that it's very interesting that when our car breaks, we know we need to conduct a MEC. But when it's about mental health, we want to Google. So I'm encouraging us, as we maybe get into the internet, we should be getting to seek to get professionals there, you know, and maybe where to access these services, but not just to, I am feeling uncomfortable and, you know, reading. Some of the feedback that we may get when we search these things online can give you a misdiagnosis, and you shall be beating yourself thinking you have schizophrenia, only that to realize you are just stressed and you needed someone to talk about. So even as we are searching, I'm also guiding and maybe recommending, we search, we prompt appropriately, you know, like, where can I get these? Because we need this assessment. I understand we have lots of assessment online, but this assessment needs to be scored. They need to be interpreted, and so that you don't get worried by concerns that are not accurate. I advocate that if we are really searching, we can search with an intention of getting help.
What you've mentioned is very key. Maybe, Sabine, that's where you come in. I mean, health is very sensitive. It's a very sensitive subject. And I understand that we are going the technology direction. But then how do we strike a balance between really ensuring that the people who explore these technological advancements that are coming in to address our health issues, mental health included, get the right information? What are some of the safeguards probably that you have put in place to ensure that people don't go there and end up wanapotea zaidi even more than they were even before they explored the platform?
Thank you for that question. As my colleague has mentioned here, if you go to the internet, there is a lot you can get there. And one needs to be very keen, because you can be misdiagnosed because of that. Because now, for example, you said you're Googling about schizophrenia. Utakuta kitu ingine huko, ubaki unashangaa, aya, niko hapa. But so as an individual, we need to, first, there is that need for us to raise awareness that there are platforms which can be used and they are safe. As I mentioned earlier, it's so easy for us to go to maybe ChatGPT or an AI tool and tell it about your feelings, and then AI will give you the answers you need. But there are platforms which works different, and especially here in Kenya, there are few. And I want to mention, allow me to mention about Let's Talk, for example. Let's Talk, the good thing about this platform, it's not an AI. You see, an AI cannot feel you. That is a robot. Robot hana feelings. But the good thing about this other platform is that these are human beings. This is someone amekulia Dandora, someone amekulia Kibira. So someone amepitia the same situation as you, ama someone who's going through the same situation as you, and they get to understand what you're going through. So kuna hiyo aspect of you knowing what you're looking at. You don't just go uende kwa AI and expect to get...
So there is human interaction?
Yes, there is that interaction between us as a human, someone who understands you, someone who has been through the same situation as you. You get it. There is that. And also confidentiality. Because now, I don't know if there is that confidentiality with an AI. I'm not so sure. But as a human being, you can be comfortable and confidential in sharing your issue with them and be sure, like, let me share this with this, And I'm so sure these things are very confidential. You get it. And another thing is that costs, as we were, my
fellow panelists,
panelists said, costs, implication, work there. Because now, therapy is not cheap, especially here in Kenya. And when tukiangalia around our economy right now, it's so hard. If I cannot afford 100 bob, I'm a 500 bob for food ya jioni, how can I afford 2,000 for therapy? I'm a 5,000 for therapy. Because now, hata itakuwa 5,000. Because now, as my fellow panelists said, therapy is continuous. It's something which you need. It's not, you can't just do one session, na ibaki hapo. You need more session and more session. So it's something which you need to revisit more and more often. Let's say if I need to have 10 session, how can I afford that 10K if I can't even afford 500?
If joblessness was the issue that created, caused this mental health issue. So how do you even afford to go for therapy? That's a good suggestion. Anthony, just also to come to you, as you pick up from where she has left, she's suggested the virtual direction. It's still the same experience, I assume, the same feel that you get when you go to see a therapist, like in a physical session, but just that this one has been taken to the virtual space. What else do we do to make these sessions more acceptable and relatable to men and bring it closer to what is called their safe spaces, so that we break this silence around mental health and men not seeking help?
Often you and I might have had individuals ask, nitakwambia shida zangu then. So I think that's where we need to start before even start looking at
after kuongea.
You know, and some individuals ask that with some backup of why they need to ask. For example, they've seen someone walk into a rehab for 90+ days and they come out and they relapse. So they actually feel some of these interventions are not as impactful as what the experts are actually saying. But we need to challenge that, because we need to ask ourselves, was the triggers to whatever condition that it was well identified? Was it well managed? Did also the patient adhere to recommendations and if prescriptions if shared, among other dynamics? But now coming to your concern, we have teletherapy. It's more accessible to many people in different spaces. But the concept of how safe it is for anyone to ask and seek these services is anchored in code of ethics. Licensed, qualified psychologists and counselors, they are guided by principles and code of ethics that dictate how patients need to be handled. As she has mentioned rightfully, one of them is confidentiality. I would wish to express myself and my weakest and deepest aspects of who I am to an individual with whom I trust with that information. Looking at how we even get to find the issues affecting our clients, we have something we call psychiatric history taking. It's a detailed approach that kind of makes an individual very well to the patient. So this is an individual that I'm talking about, my family, my educational life, how I scored in different levels, my career, when probably the challenges I faced in my career, substance use, what brand I use, sexual life, you know. So I need for me to be able to have that conversation with anyone, to be assured that whatever we are doing is confidential, whatever we are doing is safe, the information that I'm sharing is well protected. Though we need also to acknowledge there are situations which sometimes compromise confidentiality, like when we are talking about threat of life of you as a patient or a significant other. Yes, so those core principles are the ones that bring the aspect of safety. And secondly, Currently, we have Kenya Psychologist and Counseling Board, which is regulating who is actually practicing. Because we've heard it previously, someone attends a 2-week workshop, and they call themselves counselors and whatever, you know. So we have a regulatory body currently that is playing significant role to ensure that even as you seek help from this individual, you know they are the right people to support you in this situation. Yes, so teletherapy is one of them, but the safety of whatever it is
it's guided by certain principles.
Yeah, the code of ethics.
All right.
Yes.
And you mentioned the counselors that you work with are registered.
Yes.
Yeah, they have to be people who are registered, yeah?
Yes, yeah.
So I assume the same code of ethics apply and cut
Yes,
across.
it does, yeah.
All right. In terms of what he has mentioned, relapse and, you know, going back to your former life, maybe because the triggers have not been addressed. In a virtual space, how do you conduct follow-up? How do you even get into the world of that person to know what is happening around them and what could be the triggers, you know, in a virtual space? How do you ensure that the same feeling that somebody would get in a physical environment where they are seeking therapy sessions is the same outcome you're achieving in a virtual space, and conducting follow-up, you know, ensuring that you walk this journey with this person until they can actually be in charge of their mental health, you know, and sustain that momentum throughout their life.
So as a psychologist, it's advisable
Yeah.
for us to, when you're doing the session using the telehealth, it's better for you first to use the video. Like, because now if I'm using a video call, I'll be able first to see.
Oh, so it's not like a voice?
No, it's not like a voice. It's more of a video whereby I can be able to see your, because now there is something in psychology we call the mental status of examination of a patient. That is whereby you look at the appearance of your client, the appearance, you look at their behavior, the way they're behaving. You need to check all those things, and those are the things which will guide you for you to know what next. Because now I can't do a session with you over a phone while I've not done all those procedure which I need to take, like the mental status examination, and then there is that need of us doing the assessment. I can't do that over a phone. I need to do it via a video call. I need to see you. I need to see your reaction. I need to know if you're sad. I need to see if you're crying, how you're reacting. I need to be able to understand your thought process and how you're thinking. So all those things are there. And then after that, of course, we do follow up. There is that need of us after the intervention, after everything, you need to do follow-up. That is a must. So we encourage counselors to follow that guidelines, just like my fellow panelists said. Like, we follow the code of ethics, we follow the necessary procedures or steps which a counselor needs to do. So you don't just do a session over a phone and that it ends there. No, it's more of a video, and then there is that follow-up. We will just do the session next and next. Yeah.
How do you know, Anthony, that this person, you give them the green light, that they're just now okay, they can go back and they'll be on their own, so that they don't have to be dependent on the sessions? At what point do you get that as an expert, you know now this person, we've walked this journey, ako sawa, they can be in charge of whatever it is they were dealing with? How do you make that decision?
I'll start by giving us a basis on how all that process is conducted before termination, if you allow me.
All right.
Before we start managing a client, we need to understand around 4 factors. What are the vulnerabilities or susceptibilities of these patients for them to get this condition? What actually triggered the situations symptoms that we are talking about? What is maintaining them, right? And what are the strength and protective angles that we can tap and pillars we can use to support the client? And now to what you are asking about, what really determines termination of this session is 2 things. One, in our initial stages, exploration stage and psychiatric is to take in the first fundamental sessions of our therapy sessions, we set 2 types of goals. The goals that you have as a patient and the goals that I have as a professional. And we do it collaboratively. And we can set those goals by asking simple questions. How will you know that the issues that you have been addressed? Mm-hmm. You know, that's a polite way of asking you, utajuaje umepona? You know, so we set those collaboratively with guidance. We identify those clear goals. So every session has a goal. In every session there is something
you want to achieve
that we are working on, and it's guided by something we call treatment plan. A treatment plan is after I have taken your history, I have diagnosed you, I have seen the severity levels. So as a practitioner, I'm able to set a roadmap through which we shall be following. And before you come for the next session, you know what we are coming to address. So after we have addressed all highlighted concerns, and at that moment, it is evident for us to actually confirm that you are stable enough, then termination is the resolution. Mm-hmm. Again, just for confirmation, we can still do the assessment that we did and see how you score. Mm-hmm. That would be another indicator. But termination is guided by the treatment plan that I have set and we have discussed with you. Mm-hmm. Yes.
Family, how do you, you talked about the strengths, the things
yes.
that you can, what are those things that you incorporate? Because it's not just this person that you're dealing with.
Yes.
Yeah, so who else comes on board and what role do they play?
Very interesting concern, and I'm happy that you're asking about it. Psychosocial support is a strength. You know, if we get a patient who is well supported by significant, not only family members, but other significant individuals, they have a better chance of coping with whatever situation there is. Because these are the individuals that maybe pull other financial resources. They offer you support that you need, because you realize the way in which different mental disorders manifest. Sometimes they need someone who is really very patient with how you are coping. If, for example, we're talking about bipolar, the irritability, we need someone who really embraces that fact and is patient enough to work with you. And that's why I actually advocate that for a patient, the significant others and family members need to be psychoeducated to understand the condition of the patient so that they may also know how to maneuver, how to support the patient. Additionally, why it is important to pull them on board is because you may realize the triggers, some of the concerns that are making an individual to be in this situation might be family related. And so on and so forth. And some of them may be touching on even conflict management. So we are bringing them on board so that, again, we polish and iron those concerns. So psychosocial support from the family members is one protective factor. The other one is personality trait. There are individuals who are resilient naturally. Their self-esteem is high naturally, and other protective personality traits. Mm-hmm. But allow me to emphasize on something, because this now cuts across life skills. Mm-hmm. The impact of life skill sometimes is underestimated, but I like pulling it because of 2 reasons. One, there are some specific mental disorders that we find ourselves having because of, I would not say lack of life skills, but I would rather put it like because we have not effectively tapped on a life skill. For example, when you're talking about financial crisis, it might be an aspect of decision making and problem solving. Mm-hmm. Mm-hmm. So some lack of this enhanced life skills sometimes becomes a vulnerability. So equipping someone with them through training, coaching.
Preventive.
Yes, it's a preventive approach. Yeah. Additionally, it's very important. Life skills are very important even when we are currently managing the patient and even after to sustain stability. Okay. And why is it important? Because we'll pull an aspect like self-esteem. Someone with high self-esteem, it's easy for them to walk and tell, Daktari, I'm not feeling well. The self-esteem is allowing them to have that confidence to ask for help.
All right.
You know, when we're talking about assertiveness and conflict resolution, we can use these life skills to even navigate, because some of the, for example, stress-related concerns can be work-related concerns. So someone with proper conflict resolution skills, they are able to assertively negotiate and come up with the solution of what is managed.
All right.
So
is that what your book is centered around?
Yeah.
Fortitude of the Resilient.
The Fortitude of Resilience taps life skills and combines them with life skills, with my personal experiences, to demonstrate how we can use our own life skills as blueprints, you know, to stand strong when you are faced by challenges of life. And why I find it relevant to mental health is because we are losing significant others. You know, we are losing jobs every day. We are getting sick. We are being diagnosed with chronic illnesses. You know, we are getting divorced. We need to maneuver in all these dynamics. Yeah, and yeah, true.
All right. Thank you, Anthony. I want us to sample a few SMSs and you know, feedback we're getting from our viewers before I give you a chance to give us your final words. We are not having this conversation alone. We had invited you to be part of it. So on our SMS platform, this is what you're saying. Munila, hi Safin, sometimes I find myself talking alone. What can be the problem? That's a good question, Munila. Thank you for that. Mark, health and lifestyle. Is schizophrenia treatable, or is it a lifelong illness? If it is the latter, how can it be best managed? Does it defy doctors or medicine? All right. Hello, Safina. I am Arnold from Akweni. Mimi niko depressed beyond what you're talking about. I have nobody to talk to. That's Arnold. Leroy, you say, I'm Leroy from Kisii. In my opinion, men go through a lot because society judges them harshly. They often fear how they will be perceived by others. All right, I'll start with you, Sabine. Sabine, you can pick two and respond to those.
Okay.
Yeah?
I would like to answer the first question about talk. They talk about themselves. Sometimes back, I used to think that talking to yourself is therapy sometimes. You find yourself talking to yourself. It's therapy sometimes. But now, the issue comes in when you hear voices. Ama, ukienda mahali, you hear maybe somebody else is talking to you. But ama ukitembea, you can hear people, you hear voices, zinakuja. Maybe you are having other imagination. That's when you can say, hapa nako kuna issue. But now kuna hiyo, you can talk to yourself because there is that talk that we do have in therapy. We have talk therapy. I can say there is a therapy which is called the empty chair technique, whereby you talk to someone who's not there. Like you assume that person is there, but you're talking to them. That is therapy. So it can be a positive. It can help. Yes, it can help. Yes, it can help. But if itakuwa worse if you're hearing voices, itakuwa worse if kuna imaginations zinakuja etc. That is what I can say. And
what are these voices telling you? That can also be sending you somewhere. These voices unasikia zinakuambia nini. You should also think about that. But you need to talk to someone. That's what I would advise. Yeah.
Yes.
Look for help. Look for help. If it is too much and too uncomfortable for you to even mention it, then you should look for help. Yeah. Any other?
The other one is I think there was someone who said they needed someone to talk to.
They have no one to talk. They are depressed beyond what we are. Yani amesema mimi hizo vitu mnasema si kitu. Mimi I am beyond what you guys are discussing, and I have no one to talk to.
Help is always there. I can say help is always there. If you need help, just go out. Of course, it's hard, inakuwa ngumu to start, but you can give it a try. Just go, seek help. Find someone you trust, someone you kabisa you feel like I trust this person, and then talk to them. I would encourage her or him to seek a professional. Go seek professional help and talk to them. It will help.
Anthony, schizophrenia, is it treatable?
Schizophrenia is one of the challenging condition that takes significant time before it's managed. So that's why sometimes it would be considered like lifelong. And the second part is that the viewer asked, how is it managed? We need to ask ourselves, were we diagnosed formally
with it?
That's the first statement. If yes, I want to assume whoever then diagnosed you must have recommended something. In the event where that which was recommended is not working, you can always seek for secondary opinion. If it's you maybe searching and feeling like you're schizophrenic in this case, I would advise or else recommend that you approach a professional for proper diagnosis, to confirm the diagnosis. And in most cases, schizophrenia is managed with combination of both medication, we call it psychopharmacology, and the psychological support. So a psychiatrist in this case would be more resourceful, especially when it comes to prescriptions. Psychologists and counselors don't prescribe, psychiatrists do. And in most cases, psychologists do psychotherapy, counselors.
All right, thank you so much, ladies and gentlemen. Your parting shot, your final words. Let me start with you, Anthony, and then Sabine utatufungia.
I appreciate this platform for this conversation, and I'm advocating that it becomes one out of many. My parting shot would be, men seeking help is not a sign of weakness, rather a sign of strength. You acknowledge a gap that you have, you acknowledging that you need assistance. So seeking it from the right people is actually a strength. And last but not least, there is always hope, even when your brain tells you otherwise.
Sabine?
Just like Anthony has said, I would really like to encourage men to seek help. Kuomba help doesn't mean you're weak, hapana. There is, you are, wewe ni binadamu kama sisi, you have emotion, so go out there and seek help. Yeah.
All right, thank you so much. Sabine Biemba, she's a counseling psychologist working with Let's Talk 247. And of course, we were also having this conversation with Anthony Muoki, clinical psychologist, author, The Fortitude of the Resilient. Thank you so much, ladies and gentlemen, for creating time for us this morning as we were demystifying mental health in families, and special focus on men. And the most important thing that we encourage you to do is, in case you're feeling that whatever you're going through is making you uncomfortable, it's okay to seek help. That's where you can start. Thank you so much for watching. My name is Safina Chengoma. We are going to be taking a very short break right here on the show. In just a bit, we will continue with the coverage we've been doing for you. The Independent Electoral and Boundaries Commission selection panel is continuing with the vetting exercise that is seeking people who are going to be serving as IEBC commissioners ahead of next year's general election. So that is something that we will be bringing your way. And we will, next general election, that's in 2027, and it is something that you should stand by for. But for now, from Team Daybreak, it's a wrap. Thank you so much for waking up with us and for keeping us company.